It is a simple gesture. 2 drops in the mouth, administered twice to stave off the risk of polio. But for these children in Gaza, such a basic preventative act is far from simple. Teams from the UN, the WHO, and the Palestinian Health Ministry say that getting to the children in this war zone is one of the hardest parts. There is no safe passage for the medical teams or the children and families. Be it the polio vaccine or other desperately needed medical supplies, humanitarian help is only trickling in, when it can get in at all.
My colleagues in Gaza can't get in. So we have mounted missions every day in October, and every day they've either been impeded or denied. And that means no medical supplies have been getting to hospitals, no fuel, no food, of course, no people. We bring in medical teams as well.
There hadn't been a polio case in Gaza in a quarter of a century, but it resurfaced there in July, and in August a baby was partially paralyzed by the disease. Aid groups rushed to carry out a vaccination campaign in September, and they managed to inoculate over 500,000 children under the age of 10. But over 90% of them need to be vaccinated to stop polio's spread, and that requires 2 doses of the vaccine, the NOPV2. For this second round, aid agencies have mounted an awareness campaign with 800 social mobilizers. But in Gaza, it is the logistics of treatment in a war zone that are the main challenge. Carried out successively in central, south, and the hardest to reach North Gaza, aid workers continually plead for humanitarian access, with the argument that the spread of polio, like many diseases, knows no boundaries or borders.